Hello, and welcome to NCG's webinar, Physician Billing, Negative Trends, and How to Prioritize Your RCM. As your practice advocates, we are helping to redefine the way healthcare is delivered. Since 1979, our mission has been to provide software, strategy, consulting, and technologies that help create the next generation RCM solution. We make it possible for healthcare organizations throughout the country to reap the benefits of our entire suite of tools designed to maximize practice management benefits and overall cash flow. NCG Medical, in a little over 3 decades, has affected over 2,000 healthcare facilities nationwide with services ranging from practice mergers and acquisitions, strategic planning, financial advisory and compliance, to operation improvements, transaction facilitation, and clinical and technology integration. But the important message here is not longevity, it's dependability. Improving the way healthcare is delivered is not just a tagline. It's what we do, one client at a time. Before we get started, I'd like to introduce myself. My name is Heather Miller, and I have been working in the healthcare industry for over 20 years. I have assisted hundreds of practices with diagnosing and solving practice problems. There are issues from revenue cycle management, Medicare and Medicaid compliance, practice workflow analysis, electronic healthcare records, and strategic business planning. I'm excited today to share with you NCG's How to Reverse Negative Trends and Prioritize Your RCM. Defining KPIs is a standardized skill for business improvement analysts. However, if you try to find KPIs to measure business analysis, you will find little written on the subject. This presentation is intended to provide ideas of how office managers can best define KPIs to improve practice analysis and project management results. Our agenda will include a look at a KPI analysis, dashboards, decreased revenue, why, and then a top 5 RCM priority list for 2014. Key performance indicators are high-level snapshots of a practice's or a business's process based on a specific predefined measure. KPIs are typically captured and conveyed in a combination of either reports, spreadsheets, or charts. In developing KPIs, an office manager will define the target performance levels and then decide the best way to represent variance from that target. Monitoring, managing, and analyzing KPIs takes time and energy, so it is necessary that the appropriate ones are chosen to address the specific needs of the medical practice. The 2 main characteristics that help construct a relevant KPI include, 1, the need for it to be measured frequently, that's either daily or constantly if possible, as well as, number 2, there must be an understanding of what has to be done to fix outcomes predicted by the KPI. Performance dashboards are generally used to facilitate the easy monitoring of a practice's KPIs. The dashboards will check the rate at which the chosen KPI is exceeding or failing. If the result of the KPI are not improving, the dashboard will visually alert staff that changes must be made. It will then be possible to analyze what could have caused the shortcoming and allow staff to quickly remedy the situation. Performance dashboards facilitate getting the right information to the right users at the right time to optimize decisions, enhance efficiencies, and accelerate results. As performance dashboards have the data needed to measure a KPI in one place, it is easy to see if the KPIs are succeeding in their purpose or not. Such dashboards allow employees at any level to monitor information which represents the outcome of a KPI. Every office manager should strive to create exceptional KPIs, as they show the ways in which troubled practices can fix their problems and successful practices can proactively plan and manage their continued success. Practices will obviously benefit when providers can readily understand what needs to be done through the presentation of easy-to-read dashboards, allowing them to make the most effective follow-up decisions. The utilization of dashboards or other monitoring tools of your KPIs will result in specific problems that you will then need to define a problem-solving approach to determine the root causes of the problem. In most cases, the high-level KPIs are just presenting a red flag that something is going on, and in most practices, that number 1 issue that comes to the table is a decrease in revenue. For the purposes of this webinar, we are going to review possible approaches in reversing the negative trend of lost revenue. Let's start with patient volume. From the dashboard sample, you can see with your own eyes that there has been a drop in patient volume, and now we need to figure out why. Some potential approaches to take are an analyzation of the schedule templates and available office hours. Should they be expanded? Are they not at the right time of when the patients are needing? Analyze time to get patients into the office. Is check-in time taking too long? Are they sitting alone in the office rooms before the doctor comes in? Analyze scheduler behavior. Analyze your no-show rate. Analyze your recall rate. And last but not least, analyze your marketing and referral efforts. Are they even happening? Another area that can be causing the decrease in revenue may be represented to rejections and denials, undercoding, and or payer reimbursement. Let's start with rejections and denials. Are these being tracked so that you can analyze the data for specific trends and denial reasons? If yes, what are those trends telling you, and have they been educated to the staff and providers the reason for the denial so they can stop that from happening? You also may see that this is a problem with one specific payer and will need to schedule a meeting to meet with them and discuss the specific issues at hand. Another reason for decreased revenue could be undercoding. Dashboards, again, can help with also identifying when a provider is coding outside the norm as seen in the sample above. The green line representing the national norm for the coding of follow-up visits by his or her peers, and the blue columns representing the provider's actual billing year to date. This clearly would provide a quick flag that there could be opportunity to look at his or her coding and see if there was potentially undercoding for the 99214 visit that year to date has billed less frequently than their peers. Other potential reasons for decreased revenue could be patient collection issues. Do you have a credit card on file program implemented, or do you have staff that are able to properly calculate the patient responsibility so that you are collecting the correct amounts for each visit? Do you have drop charges? Are charge reconciliation reports run at the end of each day to confirm that every appointment for the day has a charge associated with? Also, if providing services in other locations or systems, are these charges getting included in your daily billing? There could be holes in this process, thus resulting in charges never getting into the system. Are you providing services that are not covered by healthcare plans? Are front desk staff confirming their eligibility at check-in and assuring that the services are still active or that the procedure they are receiving is a billable service? And don't forget to monitor your physician's productivity. You could be surprised to find out that they are actually working less hours. Completing a staff analysis and efficiency study could help with confirming that the provider is actually working the budgeted production levels, and if they aren't, what are the reasons for the slowdown? Staff processing time and activities are other potential reasons for a decrease in revenue, such as a lag time in charge posting, excessive write-offs, and suddenly cash payments beginning to decrease. Are charges being submitted daily? This is a great best practice to ensure that something is going out every day and eventually will lead to something coming in every day. Also, are rejections being fixed in less than 48 hours? If this is not happening, the more time in between, the less possibility that money can and will be collected. There should also be a denial resubmission time requirement of less than 5 days to resubmit any denial that has occurred. Who's doing your write-offs? Are you aware of the categories, and are there any categories that need manager sign-off in order to be written off? A write-off analysis report will allow you to evaluate this data and ensure that money owed to the practice is just being written off and coded incorrectly. Last and obviously the one no manager wants to have to imagine happening, but is cash leaving the building. When you see a decrease in cash for time of service payments, the question should be asked is, could an employee be skimming money? Do we have daily protocol in place to balance out cash with a deposit slip from charges billed out that day? Without daily monitoring, this unfortunately could become a very large problem no one wants to deal with. Another way to eliminate is just to go no cash, no check handling, and only use a credit card on file payment system. So we know after the past few years, it has become more and more difficult for medical practices to survive financially. Even just looking at all the many reasons we are seeing decreased revenue pretty consistently in ambulatory practices. And also, there's never been a greater time of transformation in the healthcare industry till now. So based on this, I wanted to provide a RCM priority list for 2014. So let's first discuss Doctors today, they're having to juggle multiple issues all at once. We've got our transitions to ICD-10. We've got optimizing revenue issues that we've just discussed. We have improving in compliance with HIPAA. We've got the implementation of electronic health records, all while at the same time redesigning your processes, again, to improve these efficiency and timeliness errors. And again, all of that while still trying to be a doctor and treat and keep your patients healthy. And the number one reason you really are in the business. So that's why it's important for 2014 to address these top 5 RCM priorities. Number 1 is maximizing your collections under new reimbursement models. Number 2, increasing your patient liability. Number 3, improve your clinical documentation. Number 4, monitoring the charge master. And number 5, enhancing your patient experience. Let's begin with maximizing collection under new reimbursement models. With reimbursement increasingly tied to quality of care, providers need to first develop better capabilities for measuring how clinical outcomes will impact reimbursement for each payment model. To do this, they should make use of real-time monitoring of key performance indicators, strengthening the collaboration between your departments to become more tightly linked to quality and outcomes. You want to minimize your denials and improve your reimbursement. Number 2, increasing your inpatient liability. By leveraging predictive analytics, some practices have been able to increase patient note collections by 10 to 20%. Other strategies should include expanding your upfront payment programs or options, communicating your patient liability as soon as possible, proactively managing self-pay accounts or balance after insurance liabilities, and lastly, coordinating with physician offices upon referrals. Number 3, maximize reimbursement under value-based models. Now this requires keeping precise clinical records. It entails accurately capturing presenting conditions, the severity of the illness, and the full spectrum of care provided. A clinical documentation improvement program can help ensure that your practices accurately represent the acuity and complexity of the care delivered, as well as support more accurate reporting specific to the case mix index, the present on admission, healthcare acquired conditions, core measures, and physician and hospital profiles. Number 4, monitoring the charge master. In an increasingly transparent environment, healthcare practices must be prepared to defend the rationale behind the charge for each and every service provided. At the same time, practices are currently challenged to enhance net revenue because most, if not all, of the services are paid at fixed rates by the insurance companies and therefore not subject to pricing. In these cases, the practice's strategy should shift to focus on price rationality at the line item level in the fee schedule or in your charge master. Practices need to study their specific insurance contracts as well as their markets and adjust these targeted prices in the fee schedule to a reasonable price while not creating a negative revenue impact. And last, number 5, is enhance your patient experience. Revenue cycle functions often represent not only the first but the last interactions that your patients have with your practice. Creating a seamless and stress-free experience for patients during the scheduling and registration helps set a positive tone. In addition, following care delivery, a seamless billing process can help prevent payment confusion. These patient-friendly financial processes can positively impact your patient satisfaction surveys, which Medicare is now tying to reimbursement under the value-based purchasing program. So to recap quickly, we currently are seeing the healthcare industry in its highest level of transformation with the implementation of EHR and ICD-10 and HIPAA, quality-based payment and reporting programs, causing practices to do a lot more for a lot less. Increased patient care requirements for less reimbursement are leading doctors to become very stressed about making it financially as they have in the past, leading to the importance of having a sound RCM strategy in place in order to make it in today's medical environment. You need to be able to find these vulnerabilities and correct these issues and minimize your loss. What better way is there to do this than identify KPIs, create dashboards, and then monitor this data consistently and efficiently. This will allow managers and providers to visualize the measures so that they can address them quickly in a proactive manner versus continually reacting and responding to those practice fires. If you have any further questions or needs, you are free to call or contact NCG Medical at 1-800-330-1906, or you can email us at solutions@ncgmedical.com. You can also find us on our website at www.ncgmedical.com, or follow us on Twitter, join us on LinkedIn, or become our friend on Facebook. There you can find up-to-date healthcare industry news and solutions. Thank you again for attending NCG's webinar on physician billing and negative trends.